Prevention of diseases at primary and secondary levels. After knowing about Ayurveda in general and after having learnt about healthy lifestyle and deviations from it, and after knowing about cancer, heart disease, and diabetes, in Ayurvedic perspective, it is time to emphasize on prevention of these diseases. Prevention is better than cure is the famous verse, but unfortunately, it is not so in practice. A person approaches the doctor only when it becomes impossible for him or her to get rid of the medical problem on his or her own. Many a times it is too late and then the disease becomes incurable. But even then, the general mindset of a common man is to see a doctor only if he or she gets in trouble. There are various reasons for this. The ailment will subside on its own. Why spend unnecessarily on doctor's fees? No time to visit the clinic. Why put the restrictions on oneself, etc. are the various reasons behind this. So, one avoids the medical help even when in trouble. What to speak about when one is apparently healthy? The medical professionals are also not much interested in advising people to remain healthy as well. This is because of the low income as compared to the income of treating a patient. Secondly, many times the medical systems are unable to give any advice for the maintenance of health, excepting Ayurveda. Ayurveda has one of the two objectives, maintenance of health, and it elaborates the whole Swasthavritta to explain it. Moreover, Ayurveda takes care of all the factors necessary for maintenance of health. But unfortunately, even Ayurvedic practitioners are engaged in active treatment of patients rather than for maintenance of health. As a result, neither professionals nor the common people are interested in maintenance of health, and we are wasting time, energy and money for actively treating disease rather than investing in positive health. Considering this fact, I have tried to find out a middle state to attract at least those people who are prone at secondary or primary level to diseases like cancer, heart disease and diabetes. It is hoped that people will get attracted towards secondary prevention of the diseases first and then for the next generation for the primary prevention as well. One who has undergone the horrible treatment like chemotherapy and radiation for cancer would never like to face it again for recurrence of the disease. Having Having no information to avoid the recurrence, one just remains under tension and faces the investigations periodically, hoping that the disease doesn't recur. Those are very lucky who remain disease free for a prolonged period, but they are few in number. Others become victim of the disease again and again. In spite of the same principle of total eradication of malignant cells by surgery, chemotherapy, radiation, this ultimately leads to untimely, miserable death. Though scientists all over the world are trying to conquer the disease, this area of prohibition of recurrence was not thought of. This clicked my mind and I started working on it. The same is the case regarding the heart disease. Even after bypass, the person can be victimized by heart disease and may need another bypass. This clearly indicates that this is just a mechanical solution with its own merits and demerits. It is Dr. Dean Ornish who has been successful in reverting the heart disease through changes in lifestyle and yoga. It is quite a pity to see the patients suffering from kidney failure and needing a kidney transplant or lifetime dialysis procedure. Unfortunately, nobody has thought of prevention of such condition. When I started getting patients before dialysis and could have some outstanding results in reversal of the condition or to maintain it, I thought of sharing it with others for the benefit of the mankind. There are so many diseases as well which keep on recurring very often. All allergic conditions like sinusitis, rhinitis, dermatitis, spring cataract, bronchitis, asthma, various other diseases like fever, diarrhea, dysentery, etc. keep on recurring unless and until we thoroughly investigate the patient in Ayurvedic perspective and and take cure of all the causative factors, we are unable to cure them completely. Fortunately, by the grace of the great Indian sages, it's possible to conquer all these diseases completely with holistic Ayurvedic treatment. People will find this website www.gadgil.com useful for these diseases as well. The next generation is prone to serious diseases like cancer, heart disease, and diabetes due to heredity, with other aggravating factors such as stress, addictions, improper food habits, etc. The chances are more likely. Unfortunately, nobody has tried to make these people aware of this fact and show a way to come out of this situation. This is a very first effort of its kind and is a great step to save the young generation from the serious diseases. Hectic, stressful life schedule has become a routine for certain fields. IT, BPO, media, police, private companies are the best examples. We are observing that the age for getting the heart disease is becoming as low as 12 years. In this scenario, it is not wise enough to just watch the situation and don't think of any steps to prohibit it. I was particularly distressed when I came across such incidences and I wanted to come out with some solution to prohibit them. Fortunately, belonging to Ayurveda stream, I could find answers through Ayurveda. In a way, everybody should live a normal, happy and healthy life for achieving it. Life. People also want the same, but they don't want to go into the details for achieving it. As mentioned earlier, the medical professionals either are unable to find the principle or are not willing to do so. This is a humble effort at global level for a healthy society. Everybody should support it for his or her own benefit. In order to execute this plan of prevention of diseases, I decided to bring Ayurveda and Yoga together with some other professionals. This started with the concept of Ayur Yoga. Yoga has already spread. Yoga has already spread worldwide, and Ayurveda is also spreading gradually. Both of them are complementary to each other. The combination is beneficial to the mankind for prevention and cure of diseases globally. To summarize, 1. Ayurveda has one of the two objectives, maintenance of health, and it elaborates the whole Swasthavritta to explain it. 2. Instead of mechanical treatment like surgery, chemotherapy, kidney, heart transplant, or dialysis repetitively, one should aim to stop the recurrence of disease at secondary level and follow a healthy lifestyle as advocated in this book to prevent secondary onset of the disease. The same logic can be applied in the next generation to prevent the disease at primary level.